You are listening to Pharmacy, IT, and Me, your Informatics Pharmacist podcast.
Hey guys, so what's up? My name is Tuan. I am a guest on today's podcast, and so the reason for having me here is because I'm more of a traditional type of pharmacist compared to these other four guys here. I'm a specialty pharmacist. I started off working in retail, and I've been doing that for the past 5 years, and so I wanted to get connected with these guys because I wanted to see what else was available out there and what just network with some really cool and important people in the pharmacy world nowadays. So let's start off with that. And guys, introduce yourselves and then let's go from there. Go ahead, Beju.
Hey guys, so I'm Beju. I'm a clinical pharmacist at a medical center in South Carolina. And I primarily work with our informatics team, optimizing our EHR. I'm also have been in practice for about 8 years now. So yeah, it's been a minute.
Hey everyone, my name is Brian. I'm an Informatics pharmacist. Been most recently working on implementing Epic across our institution, and I primarily worked with the antimicrobial stewardship and infection control programs.
Hello everyone, my name is David Vu. I'm a recent graduate from VCU School of Pharmacy, graduating in 2018. Right now I'm working as a project manager and quality assurance engineer at KitCheck, which is a health IT company that specializes in pharmacy technology automation. I primarily work on BlueSight for controlled substances, which is a drug diversion auditing tool to help detect abnormal provider behavior within the hospitals.
Hi everyone, my name is Tony Dow and I am a clinical informatics pharmacist. I worked at a government hospital for 5 years as a clinical informatics pharmacist where we implemented a brand new CPOE, CDS and BCMA system. And I currently work at a pediatric hospital for the last 2 years doing pretty much very similar duties.
That was a lot of initials that I had no idea what meant. Just putting that out there. I don't know what any of those initials meant. Very cool. Okay, so I'm more of a traditional pharmacist. I don't know anything what these guys do. So, Beju, you said you've been working in this position for about 8 years. Is that right?
Yeah, so I actually started out kind of on a traditional setting. I started out as an inpatient hospital pharmacist, learning the operational workflows and also the clinical processes that go sort of underlies all of our systems at our hospital. And so I got to know our systems from the inside out for 2 years. And from there, I transitioned to more of, improving our processes and getting more aligned with how do we leverage technology to do that. And I joined the pharmacy informatics team at that point after 2 years, where I really started to gain more knowledge of how these systems work and how they impact our users. And then looking into things like how do we design solutions, or optimize systems that are more usable for clinicians and for staff became more important. So, in one way, I kind of had a traditional start, but I feel like I've always had a non-traditional mindset in the heart of it.
So how did you transition to that role?
Yeah. So,
how did you fall into that opportunity?
Basically got into my role by providing solutions to the folks who were driving our technology and information systems. And I did that because I was becoming more of a liaison for projects and helping to assist and consult with different implementations. And so I usually got tagged to do different types of work for our area just simply because I was subject matter expert in our inpatient pharmacy. And at the same time, I was able to kind of translate the technology speak or lingo to helping design these solutions. So I think that's worthwhile knowing for others is kind of start to bring problems to the forefront, but not only bring problems, but also give solutions and give options where, others can, help support your area and make it sort of more optimized for your group. So I think that was an important first lesson I learned was really just kind of bringing solutions to problems that exist in healthcare.
So this team that you're working on now, it's part of the hospital and not part of the health record system? Is that what I'm getting?
The team I'm on right now their primary role is basically to maintain the EHR. So I'm actually under the IT department. We were part of the pharmacy department at one point, but we transitioned to the IT department with some restructuring that went on at our enterprise, but we're very closely connected to our pharmacy department in terms of engaging our pharmacy management and some of our super users to optimize the electronic health record. But yeah, we have a different dynamic because since we are part of the IT department now, we are also, we're kind of connected to other teams, other non-clinical and clinical teams that we weren't privy to in the past. And so I think that's a huge advantage for us because we now have access to, for example, access to data that we never had before simply because we have a closer relationship with our data analytics team. That's just kind of one instance of the structure now that we're part of.
Why is it important to have someone like a pharmacist on the IT team?
Yeah, I think pharmacy has to be at the table in all areas of healthcare, right? We kind of talked about this offline earlier, but I think even more so for IT. I think the medications processes span the whole spectrum of the enterprise. And so, first of all, not being at the table kind of creates a lot of gaps in the processes, in the systems.
Can you give an example of a gap?
Yeah. So early on, I think we went live with Epic kind of close to 2012 in the ambulatory side of things. In inpatient, we went live with Epic later on. But in those early discussions, pharmacy wasn't at the table as much. And so some of the build that was done for medications, simple build that we kind of take for granted now, it was sometimes done by nurses. It was done by non-pharmacists. And when we took over those systems, we saw there were inherent issues. There are actually safety issues. There were sort of quality issues from that build that we inherited, and we had to redesign to make it a little bit more safer and more effective for clinicians. So bringing that clinical context, that clinical pharmacy context to the design of even systems, I think was a valuable thing. And I think I wish we kind of had been brought in earlier to those discussions. So that's kind of maybe one piece of it.
Do you have any extra training beyond your pharmacy degree?
Yes, I actually started out as a computer science and business major in my undergrad. So I went through that part of my phase in life. And I think it was around 2000, 2001 where those jobs had kind of dropped off. The dot-com bubble had bust. And so I decided to pivot and change directions into healthcare. And so I landed into pharmacy, which seemed to be a really great opportunity to be more versatile. But I think that's another lesson I learned early on was, your identity, doesn't have to really be aligned with your background. You can always change careers, you can change industries, especially at that early age.
Tony, can you tell me a little bit about what you do at your work and what your job position is?
Yeah, so my position currently is pharmacy IS or informatics specialist, and that's at my current place of employment, which is a large pediatric hospital. And the position I have at my previous employment was a clinical informatics pharmacist. And even though the titles are a little bit different, most of the activities and functions are very similar. So every day is different. So it's kind of really difficult to say what I do every day, but it kind of is broken down into projects versus break fixes. And at my current employment, I am under the IT department, and I function as the pharmacy resource. And all of the tasks that I'm part of, half of my time in projects is dedicated to oncology EHR. And I have to leverage the system in a way that will accommodate for the complicated workflows that oncology pharmacists go through for, verifying orders that are from oncology order sets that include day of treatments and regimens and things like that. Some of the other things I do on the project side of things is work with the pharmacy department, like the managers and the supervisors for optimizing parts of the system. Like if there's something that we can kind of automate to help with the workflow, then we try to do that. And then the other part of it is break fixes, where there's a bunch of different technologies that we have. We have a robotic IV automation machine, which is a giant robot that, makes IVs. If there's any issues with that, And sometimes there's issues with CPOE, which is computerized provider order entry. It's like sometimes they try to order something in the system, it's not there. Then we have to figure out why it's not there, or even if it's supposed to be there in the first place. And we also kind of, triage whether what people are requesting it makes clinical sense or not before we actually build it. And if it does make clinical sense, then is it something that our institution is going to approve? So then we also try to bring it to the right group of people to bring it to meetings to get it approved. Some minor things I also do, another informatics pharmacist at my workplace does this more, is the troubleshooting of barcode and medication administration. So, drug shortages happen all the time, right? And NDCs change all the time. So maintaining the inventory is a constant struggle, and we kind of share the duties on doing that between the different informatics or IT pharmacists. And doing that also ties into making sure that they can be scanned correctly when nurses are administering the medications at bedside. So yes, those are just some of the things that I do. And other things too include like building rules in the system and building like additional order sets for certain disease states and things like that.
Sounds like a lot. Man of many hats. So, Tony, did you start off in that position, or how did you get your start?
When I was in pharmacy school, I was interested in the prospects of pharmacy informatics, and I had learned that there was a PGY2 pathway for it. For like many people in pharmacy school, like a residency is something that we've been kind of geared towards, or like our educators have let us know that that's like a means of getting to where you want to get to in a very efficient manner. So of course, I applied for residency, and unlike most of my classmates, I actually did not get matched. And so after that, I tried to figure out other ways where I can get into that role. And I kind of just thought back about all the different projects I've done as a student and kind of updated my CV for that and started applying to all these different positions. And I also spoke with a bunch of my preceptors at the time that, they knew what my interests were. So they always were keeping a lookout for me too. So they kind of just let other people know. And then eventually an opportunity came up at government hospital where they heard about me because my preceptors knew the director over there. So it kind of became like a word of mouth. And so they had called me in and they reviewed my CV and then gave me an interview. And 2 days later, they offered me the position. So that was how I got into my initial role.
I see. So you use your networking, your preceptors and their network to find that position. How long after graduation did you find that position?
After graduation, so I graduated in May. I studied for my boards, took my exams July. So I got licensed in early August, and I started at the end of August.
Oh, okay. So that was fairly quick for you. You started in that position. You didn't really migrate.
Yeah.
Okay. All right. Did you have any background like Beju did beforehand?
Not like an official education in terms of like computer science, but I just had a hobbyist background. Like I learned Objective-C like just for fun, just very basic knowledge, and it was something that I was always interested in. So yeah, it wasn't like any formal training.
Did you have to get any extra formal training? Was there a big learning curve in your new job, that position? Because I mean, in pharmacy we don't learn anything about that. It's all clinical stuff. So did you have to increase your learning background or your knowledge?
Yeah, actually, initially when I started that job, it was a learning curve. And the thing about most large vendors for like electronic health records is that a lot of their information and, languages that they use are proprietary. So even if I had training like of a general sense beforehand, I would still have to relearn on the job. So for where I worked at that government hospital, I did have to spend a lot of my own extra hours, which, I chose to spend extra hours myself to learn the system very well by leveraging their, they have like this kind of, online forums for, online networking forums for the vendor. So I kind of just went through that, looked at all what other sites were doing and just seeing like how they built things, and spent a lot of time on trying to improve my knowledge as fast as I can so that I can be as useful as I can to the institution that I was working for.
I see. But you didn't have to do any extra, certifications or your residencies or anything like that upon graduation?
No, I didn't. No. Eventually I did because I just wanted to learn more, but it wasn't something I did initially.
Gotcha. Okay, cool. All right. David, tell me a little bit about your position now and what you do.
Sure. So mainly I work with our drug diversion software, BlueSight for controlled substances. And so I function as a project manager and quality assurance engineer for our product. And primarily what I try to do is we have large amounts of customers that are being implemented with our software. So I'm making sure that everything is on track in terms of the implementation of the product, in terms of a data quality perspective. And so we have differing timelines for every one of our customers. So I'm just making sure that in managing is the quality of their data the best that it could possibly be and ensure the best data integrity. So I work with our implementation specialists and I work with our QA team and the developers to make sure that all that is coordinated properly. And if there's any issues, then it would be up to me in terms of next steps that we have to go to get these hospitals implemented with our software. And so in terms of a day-to-day, there's a variety of things I do within our company. So I nearly touch every single team within our company. So I could be working with our implementation team, and I could be part of customer-facing calls. I could be working with our support team, either providing information in terms of the logic of our codes and why it may appear in a certain way in our applications. And as a QA engineer, I could be working on testing new features that our developers has created. And also I'm able to code myself in terms of creating the hospitals itself for that software. So a lot of different functions that I do within the company. Since it is a healthcare IT company that's a little bit small, I have a lot of ability to work with many facets within the company.
Why is a pharmacist needed for your, why is a pharmacy degree needed for your role?
Sure. So in terms of your direct question, a pharmacy degree isn't needed for my role. It's certainly beneficial to have. In terms of the amount of pharmacists within our company, we only have a handful. And so me being the only pharmacist on the engineering team really allows me the capability to provide a lot of value to the team and to our product and to the company, just because the rest of my team are developers, are technically oriented. So if they have any pharmacy workflow questions or clinical questions about the data or how something should work for our end users, since our customers and end users are pharmacists and pharmacy technicians, having that understanding and background definitely helps in terms of the overall quality of our product. And so in terms of that answer, it's not necessary to have, but it's extremely valuable to have to provide that sort of context behind it.
Yeah, how much clinical insight would you say you offer?
That's certainly a good question. There is a question every single day for me. Since I'm working with pharmacy workflow, and then I work with medications in terms of as we build the application. And so I'm faced with a lot of medication questions quite frequently.
How did you? I know you graduated recently. You are the most recent graduate. How did you come into that role?
Sure. So I knew about KidCheck because we actually implemented KidCheck at the university I was at, and so I was part of Pharmacy Informatics research elective, and it just so happens at that point of time they were implementing KidCheck to our university. So I was able to be a part of that, understand what their product was, and really be able to go through the implementation process and be able to teach back to the end users, which would be the pharmacy technicians and the pharmacists, in terms of how to utilize that product. So I already had a great understanding of what KidCheck was, and it was healthcare technology to improve efficiencies within the pharmacy. And so that's how I knew about KidCheck. When I graduated and I passed my boards, I was looking for positions, and I was looking for staff pharmacist positions, clinical informatics positions, or anything in the health IT field. And it just so happened at that point of time, there was an opening job posting for a data analyst on their implementation team for KidCheck. So that position in itself didn't really require a pharmacist to be in that role. The posting itself, it was a bachelor's with a couple years of data analyst experience, a plus if you had healthcare experience. So mainly they were looking for someone very analytical for that role. But for me, that was an opportunity where I'll be able to jump in, provide value as a pharmacist and have that clinical background in order to improve the overall product at the end of the day. And so, taking on that role was a little bit risky, knowing that it wasn't a pharmacist position. But I knew what the company was, and I really liked their mission, which is to improve efficiency in healthcare. It frees up the clinician's time to do more important things, such as treating the patients. And so that really motivated me to join KitCheck. And, I felt like I was starting at ground zero. It was an opportunity to grow quickly within the company and provide a lot of value. And so after I became a data analyst, a couple months later, I moved on and became a QA engineer on the QA team. And then a couple months after that, I became a project manager for our team. There was definitely a lot of opportunities to grow within the company and advance.
Did you have any background with, informatics or anything like that beforehand, like how Beju was a computer science major?
Yeah, I didn't have any background, technically speaking. So when I graduated from my undergrad, I had a health science degree. In terms of computer science and all the other aspects, I did have some slight background in a little bit in engineering and took a few computer classes and HTML, CSS. And so I knew those were the sort of aspects that I liked about it. I didn't really think of it as a career or anything until further down in my life. And so as I reflect back, those were the type of things that were really interesting to me, because you'll be able to work with something, create something out of really nothing, and be innovative and creative at the same time. But in terms of the technical background, I wasn't a kid that did coding the rest of it, the beginning of his life until now. So really going to pharmacy school, I had a completely blank slate in terms of technical ability. But pharmacy informatics was something that really stood out to me. And so I went and found as many experiences as much as possible to make myself eventually a viable candidate to become a pharmacy informaticist. And with that, still not having that much coding knowledge, but being able to understand how to work with data, to me, data is, right now at least, it's gold. We have so much capability to pull in as much data as much as possible, but what do we do with that? And then how do we augment that so it makes some actionable results? So that's what my niche was throughout pharmacy school was, I wanted to work with data in order to make great clinical decisions out of it, serving as evidence. And so that became my niche and that became my brand. And so as I was looking for jobs, that data analyst position was a perfect position for me because it was a pharma technology company. They were looking for someone with data analysis experience. And it just felt like it was the perfect storm of potential right then and there.
So, Brian, can you tell me a little bit about what you do in your full-time job and not your extracurricular activities?
Sure. So I'm actually currently in a transition, so that is still being defined. So I'll go back to the role I was in the last 4 years. To keep it kind of simple, for those of us who are in informatics or are looking to get into informatics, the role that I played was basically to help with a go-live implementation. And I never realized this, but it's kind of a nebulous term to a lot of folks who aren't in informatics. What we mean by go-live means you're turning some software on for a group of users. And in this case, the go-live was conversion of all of the different software programs that our hospitals and clinics used into one software, which was Epic, a electronic health record. So that's a go-live, and we implemented it. So sometimes you hear us call it go-lives or call it implementations. So what I did for 4 years was basically help convert all of the programs associated with antimicrobial stewardship and infection control from whatever legacy system that was used in the past to Epic. And, we don't have to go into the specifics. I think Tony mentioned that it's very difficult to define what we do in informatics. And the reason why is because it changes so much. So I think the easiest way to put it is that was my job to convert whatever software system that you used in the past to this new system. And if that entailed, hey, we need to get a meeting on the books, we get a meeting on the books. What do we discuss? We discuss, hey, what did you actually do in your day-to-day job as a infectious disease pharmacist? Oh, we had to get a list of patients for this unit. Okay, how do we do that in Epic? And so I would, figure that out. We would have meetings. We would do all those kind of things to determine your scope and then create tasks to work through those things. So that's kind of what I did in a nutshell.
How long does a implementation like that take when you're transferring old legacy to the new system?
Yeah, that's a good question. I think it ranges quite a bit. And some of the largest factors is, of course, your institution size. Also, it kind of depends if you're going from paper to electronic. In our case, it was going from a very, very, very mature system that was developed over 25 years into another electronic system. So ours started in 2015 and it ended at the end of 2019, so about 4 years. But there was a hospital system that was pretty small, I think less than 100 beds in the same city that I'm in, and they did it in a few months. So it completely ranges on your institution, but I would probably say, let's say 6 months to 4 years.
So you said that you were responsible just for the antimicrobial stewardship aspect of that. So is there a pharmacist for every disease states, or is there one for cardio, to say?
Yeah, we have quite a large staff of pharmacists, so we're quite specialized. So there's definitely like a cardiology pharmacist, a critical care pharmacist, infectious disease pharmacist. And I know like we can use the example of MD Anderson where they're known for oncology. They have things that further delineate into bone marrow transplant pharmacists or, now this is going to show my ignorance on other disease states, but all the different types of oncology or cancer states out there, there's a different specialization for. So yeah, we had that.
So there's a bone marrow specialist, pharmacist, informaticist.
Oh, you mean just for informaticists?
Yes.
Oh, great question. No, we do not. So my role was to implement this, but this is going to get confusing. This is going to get confusing. And the reason why it's going to get confusing is because the way go lives or implementations go is it's determined by the vendor. So with Epic, I implemented antimicrobial stewardship under Willow. Willow is the code name for pharmacy. I implemented infection control, and the code name for that in Epic is Bugsy.
That's so cute.
So anyway. So it's kind of strange in that sense, but my title and my role isn't officially a infectious disease informatics pharmacist or antimicrobial stewardship pharmacist, and we don't have any types of those roles, despite kind of working in a defined specialty. We are all informatics pharmacists, and we support all aspects of informatics pharmacy.
Gotcha. Can you go into a little bit about how briefly you got into this position?
Yeah. Most brief way to say it is that my whole training has led me down the route of being interested in infectious diseases. There are many pivotal moments that led me down to this road, but one that comes to mind right now is that I had an interest in public health, and I reached out to a pharmacist that worked at the CDC, and I was like, how do you get there? And she said, we don't need pharmacists at the CDC. We don't need pharmacists in public health. But what we do need is someone that can bridge the gap between the clinical practice and informatics. That's what we need. And at the time, she was working on the antimicrobial usage program that is quite large. And that's how I went into informatics, or began considering informatics. And in terms of my specific role, I just got really, really, really lucky. The organization I was working for decided to implement, and they hired 500 people for this project. It was a big hiring time. They recruited at ASHP mid-year. And it's not too difficult to get 1 out of 500 positions. So it was right time, right place.
How much clinical knowledge do you use on a day-to-day?
That's a great question. I would say my role is pretty heavy clinical, and the reason why is because I work primarily in antimicrobial stewardship. So I build tools that our infectious disease physicians and pharmacists use to take care of patients. So an example is like a bug-drug mismatch. If a patient they have VRE growing, a blood culture.
Yeah. Come on, talk nerdy to me.
Yeah. There you go. I wish I had some memes to help support here. But yeah, a patient comes in, they have a positive VRE growing in their blood, and they are on vancomycin. We all know that vancomycin, or we should know that vancomycin doesn't cover VRE, but we know other antibiotics like linezolid or daptomycin do. So I would need to know that, and I would need to also know the build in the system that equates to linezolid or daptomycin, and that which equates to vancomycin, and conjure up a rule that will trigger and display to the clinicians when that happens. So it's very important to understand the clinical aspect to do that kind of job, because it's also communication with your end users. If you can't speak their language, you would have a very difficult time in translating it into a tool that they can use.
I think that's the key here that I've taken away from talking to all four of you, is that you need to be able to speak the language. And so that's why having a pharmacist in the role of informatics is not only beneficial, but I think it's also a necessity, in the sense that you're building these systems that are being used by a pharmacist, a nurse, a doctor, but then they're being created by technical people that don't have any knowledge of such database. So I think that's why that this role is exploding, is growing, is because it's important to, like you said, speak the language that both the technical aspect side of it and then the clinical aspect side of it. I think that's really cool. So to wrap this up, I think my question is that, this here we're trying to give advice to new graduates that are coming out. And for the most part, a lot of these new graduates are going to be traditional, like myself. They're going to be people that are going into, one of two things. They're going to go into the community setting, or they're going to be going to inpatient. Maybe some people are going to be doing fellowships or stuff like that. And so the object of this is, how can we help those that are coming out to reach a non-traditional path of being a pharmacist? So if you guys had to go back and talk to your recent grad self and give advice of what you know now to that youngin that just graduated, what would you say? Beju, what would you say to yourself 8 years ago?
Yeah, that's a really good question. And, I think if I knew now what I knew then, I think I would say that anything is possible as long as you have a vision for what you want to do, how you want to contribute in this world. And, some of the things that I didn't have back then are now just taken for granted for. Like, I think David mentioned a couple of things, didn't come from the traditional computer science background, but I don't think that's needed anymore. I think all the tools and resources are out there, and they're freely available to self-learn some of the kind of knowledge I picked up. Simple things like knowing what a database structure looks like, or how to run SQL queries, all of that's out there. So I think actually I would love to be, like my former self would love to be in this space right now, because I can really 10x my former self in that regard. So yeah, that would be my sort of main point, is the opportunity is wide open, even more so than in my former self. So does that make sense?
Yeah, that makes sense. Tony, what would you have to say to your former self?
Well, I think for my former self, when I was graduating, I was looking very specifically into pharmacy roles, and it was looking at informatics pharmacists. Yeah, like that's where I am today. But, nowadays there's a lot of different roles a pharmacist can do. And I know a lot of different colleagues that are pharmacists who are in those type of roles. Like there's someone I recently spoke with where her title was basically an IT analyst, but she happened to have a pharmacy degree. So, I think I would tell myself, don't limit my searches just to pharmacy informatics, pharmacist informatics. And, Dave is an example too that, you can get into a role that does not need you to be a pharmacist, but because of your background as a pharmacist, you can make the most out of it. So I think like for me, like that would be the main thing that I would tell myself is don't limit myself and just know that there's many things that I can do with my degree that doesn't have to be a pharmacist role.
I like that. That was good. David, I know that you graduated just a year ago and you probably remember a year ago, but if you could go back and give advice to him, what would you say?
Sure. It's really to have self-awareness of yourself and the goals that you want to achieve out of your career. So going back to kind of what Tony was mentioning is, should you be defined of just pharmacy? And so that was a big discussion that I had with myself as I was trying to choose jobs, was trying to justify going through 4 years of school, I should be a pharmacist. And that was a common question that I always get is, why are you choosing a data analyst position? What are you using with your pharmacy degree? And with that, I definitely would say, at the end of the day, it was an innovator. And being a pharmacist was an additional title. But at the end of the day, I wanted to innovate and create. And so those are the type that drove me to select the decisions I made in order to become what I am now. And so my advice to everyone is just be self-aware of yourself and then think about the goals that you want to achieve. Not be limited by titles, by really anything. And so it allows you to have more visions of other opportunities and opportunities that you didn't know that you might ever have. So, taking down the titles and just thinking about, can I do this job myself at the baseline of it? So that would be my best advice for anyone.
And lastly, Brian, what advice would you give to yourself?
This is such a hard question. And I think it's a hard question because I don't know if the advice that I would give myself is the same advice I would give myself tomorrow. And the reason why is because, as much as, all our viewers watch us and think, we have things all thought out and planned, and in reality, we don't. And we always change in what direction we go. So, I think the advice I would give, and it's certainly not related to our topic at all right now, but I have another one that I can say that is more related. The first advice I would say, though, is that 8 years ago, how long has it been? 6 years ago. 6 years ago when I graduated, the only thing on my mind was work. And I think if I were to go back and tell myself something, it would be to not work as hard, because work will always be there, but relationships are the most important things to cherish. And I think that's so, so important no matter what you do. Find something, whatever it is, that makes you happy and stick to that. And I think for a second advice that maybe is more related to this topic is find a mentor, because you can subscribe to YouTube channels, you can watch podcasts, you can read blogs, you can look at various subscription newsletters from various organizations to get an idea of what's out there. But I think mentors, especially mentors who have many years of experience, can give you a better idea of all the different things that you can try out there. And they'll guide you along and, perhaps look at things in you that you might not have seen yourself, and maybe guide you down a certain path. So I think mentors is like my general answer to a lot of things that I wish I would have done myself, is to gravitate towards someone that can help me with certain things. So that's kind of my two advice is I would give myself.
So I think it's really interesting here. So what I've gathered is a common theme is that none of you guys really started off on the path, right, to be informatics pharmacists. You guys kind of fell into the position a little bit, and then you, aside from Brian, self-learned for a lot of this. You guys had a lot of training on the side and did extra work to get where you guys need to be. That you guys were motivated and dedicated enough to continue to go do that path. And another theme that I found is that you guys use your networking. Tony, you reached out to your preceptors and sought their networking. David, you were involved with KitCheck already on school. Brian, you reached out to people, and through their networking, you were able to find your position and find your calling. So I think for advice that we have for the outcoming students, the incoming pharmacists, is you're going to have to continue learning. Learning won't stop. And two, you have to reach out to your network. You have to connect and meet people that are in different fields of pharmacy, because the world is a much smaller place now. And I think it's important to make those connections. Well, thanks, guys, for joining us. Hope that was helpful and the advice was sound. See you guys next time. And remember, guys, technology is the tool and patient care is the goal.